everyone. Um, Today we are talking about relapse prevention strategies. Megan and I are from Colorado Spirit. Colorado Spirit's mission is to promote resilience and empowerment during this time of the pandemic. And we provide brief counseling, resource referrals, psychoeducation, and pretty much anything that can support the community during this time. My name is Louie Pinkerton. I am the outreach specialist. And Megan, if you can introduce yourself.
Yes. Hi, everyone. My name is Megan Kearns. I am the crisis counselor for our team. And so excited to have you all here to talk about some relapse prevention strategies. All right. So to get started, we wanted to start with this quote from Mr. Rogers. So anything that's human is mentionable, and anything that is mentionable can be more manageable. When we talk about our feelings, they become less overwhelming, less upsetting, and less scary. The people we trust with that important talk can help us know that we are not alone. And we really wanted to just talk about this because I feel like a lot of times there's a lot of stigma that comes along with substance use, and it can end up being a very lonely experience for these individuals. And so wanting to start off and talk about the fact that we start talking about these and having conversations with our loved ones, it can make everything much less overwhelming and make us feel like we're less alone. So substance use is a disease that affects the brain and behaviors that can lead to a lack of control around certain substances. Decades of research have found a strong link between exposure to trauma events or traumatic events and substance use. And conversely, individuals with substance use disorders are also more likely to experience traumatic events, leaving millions of people in a perpetual cycle of traumatic experience and increased risk for abusing substances. When we're in situations of high stress, we turn to the coping we know. And for a lot of folks, this is substances. Substances can help us numb out our emotions and feelings when they become overwhelming. And when our stress is overwhelming, we turn to these substances more and more. I personally choose to reconceptualize substance use as a coping mechanism rather than as an illness, because I think this helps bring more hope to recovery. Adding more skills to our coping toolbox means that we have more options to turn to before we get to a place where substances are what we're turning to. A lot of these same neural pathways exist with all types of addictions. So they're not really unique based off a specific substance. So alcohol versus heroin versus gambling versus a porn addiction, they all are going to have very similar neural pathways and be treated in very similar ways.
Let me know when you need me to go to the next slide.
Okay, we can go to the next slide.
Okay. I also just wanted to say to the audience, it's okay that substance use as a coping mechanism, from what I've learned, is that you never want to take away their coping mechanism until you introduce more yeah, exactly. So I just wanted to say that for the audience at home.
Yeah, absolutely. That's a great point, Louie. If we just start taking away coping mechanisms without giving them something to be able to turn to instead, we're just setting folks up for failure. So some of these different treatment approaches that we were talking about is the one that almost is more of what we're speaking about is this harm reduction, right? So this is kind of this idea that if we're not going to be able to get folks to stop using the substance entirely, maybe we're just going to make it a little bit safer for them. So this is stuff like clean needle exchange programs, safe shelters for folks that are using a substance so that they are not, they're in a place that they can receive medical care if they need it. Harm reduction is simply seeking to make circumstances safer for those with addictions. And these are centers that provide clean spaces for people. They take their drugs and test them for them to make sure that they are what they believe them to be, help try and stop the spread of infectious diseases. They have Narcan on hand. A lot of these programs help bring just humanity back to how we treat those with substance use disorders and help them feel more deserving of sobriety and recovery. Abstinence is another method that's used for treatment. It's been the primary method for the past 50 years or so. Harm reduction has existed for about the same amount of time, but these programs are often very underfunded due to political ideologies disagreeing with the premise of them. And then this last one that we included was psychedelic therapies. So these are a relatively new treatment modality, but they're showing some really amazing results so far. Ayahuasca is a psychedelic substance that is used in substance use treatment, and it has similar properties to psilocybin or magic mushrooms, as they're more commonly known. And these are therapies that are done in an office with a trained professional, similar to how maybe an outpatient treatment for that a doctor would do for a colonoscopy. For some, that they are able to have one session with ayahuasca and they are able to have complete cessation of substance use. So these treatments are really proving to be pretty groundbreaking. Okay, we can go to the next slide, Louie. All right, so what does recovery really look like? I think this really comes down to an individual decision about what values are important for this person. For so long, we have grouped folks together for their addictions and their treatment and ignored that there are differences in treatment for folks based off different identities that they have. For some, a sober life is important, and the way that they see recovery is totally different than those who maybe choose a harm-reduced life. Both of these are okay ways to be in recovery. Like I said before, the goal of recovery is to provide others other and less harmful coping tools. I think this is a very individualized process, but we've really only been sold on one method, but that method sets folks up to fail with this kind of all or nothing thinking. Those with substance use disorders often say that relapse is part of recovery. And some argue that if you're committed enough that recovery that you'll never relapse. And while I don't personally agree with this, I feel like it can create a lot of shame for those that do relapse. We can't realistically say we understand someone else's commitment to recovery. I really like to look at this as an individual process that each individual gets to create for themselves. So if you have a loved one or that has struggles with substance use, do what you can to support them, while also trying to recognize that they have autonomy and their actions are ultimately their call. All right, we can go to the next slide. So here's a quote from the American Addiction Centers that says, "Addiction is not a choice that an individual can control, it is a compulsion. So they are unable to stop consuming drugs or alcohol without help." And I think this is an important thing to remember when going through recovery yourself, or if you're helping a loved one with recovery. Addiction and substance use can be very insidious, so it takes a lot of patience and work to be able to get to recovery. So try to have patience with how much influence you really have. Resources that help recovery. How do we achieve this? So we can do things like work on developing coping strategies before we need them. Therapy to talk about triggers, urges, stress, trauma, treating any co-occurring disorders or symptoms. Doing stuff like removing substances from the home can help make it harder to access substances, so that in moments of having urges or cravings, they can kind of delay that a little bit because it's not in the home, so it's not quite as instantaneous. If it's important to you or a loved one to not have substances around the house early on in recovery, it may mean that everyone is abstaining as well. Support groups like NA or AA are great places to seek support when struggling from a community that really understands. Online communities can be really helpful right now too in our virtual world, as we're still trying to navigate the pandemic in as safely as possible. Reddit has a lot of great communities with great resources to talk to people about, be able to talk to people somewhat anonymously as well. Family of choice is also a great part of recovery because recovery often means having to set boundaries, and that may mean having to cut off relationships that are toxic or not helpful to recovery. Family of choice can help create a family that is going to make your recovery a priority for them as well. All right, we can go to the next slide. So here are some coping strategies from the American Addiction Centers. These are great things to start to try and incorporate into life, such as exercise is a great way to start releasing endorphins and feeling good and feeling like you have a goal to accomplish. Mindfulness meditation, really trying to get into the goal of meditation of being present in this moment, and maybe not so much. I remember when I first started to try and meditate, it was a lot of me sitting in a dark room and just being like, oh, I guess this is nap time. But meditation, it actually requires a lot of intentionality for something that's supposed to be about not doing anything. Spirituality is another great coping strategy, finding some connection to something larger than ourselves, whether that be organized religion or it being just being out in nature, or being connected to the fact that we are all part of the human race and connecting to that as something that's larger than you. Positive reframing and humor, being able to laugh and enjoy being able to like have laughter in life again, and not just constantly being focused on. Can we pause it? That's going to be a point where it's I need them to cut that out. And art and journaling and creative expression is another really great way to be able to express what you're feeling, express what you're thinking, and kind of get it out of just sitting in your head and putting it out into the world. Communication and reaching out for support early and often. This is really great. This is where that family of choice really comes in, of having folks that are supportive and committed to helping you really grow and strive to be the best person that you can be. And then giving back or volunteering is another really great way to get out of your own experience and be able to give back to others that are also struggling, and kind of connects back to spirituality of being connected to something larger than ourselves.
Those are great coping strategies. And I'd like to add a little bit about the mindfulness meditation. We have a partnership with Jefferson County Public Library that does a really great meditation every Thursday. You can call in, and there's also recordings. So it might be hard to find the meditation, but those are already there. And libraries are just great resources for connection, and you can get craft kits, a bunch of stuff at libraries. And also, we also have a coping strategies recording where we talk about doing coping strategies for you, and not just because somebody says that you should do them. It should be authentic to what works for you. So maybe lots of exercise isn't the most beneficial. You wear yourself out, but you really love to just create art. That's perfectly healthy. So are we good to go to the next slide?
Yes.
Cool. Okay.
Yeah, so continuing on, I think another part of recovery is making sure that we have these kind of like relapse prevention plans in place before we maybe really need them. So having like a note card box full of different note cards with different things that you can do when urges come up. Maybe try and get that rainbow card pack so that you can color code them based off of the time they take or the type of activity it is, but like making it as simple as possible for yourself in those moments of crisis to be able to find what you're looking for as something that can like help with urges and cravings. creating an SOS kit to use in those most intense moments. So having things like mints in there or sensory items, rocks, coins, rubber bands, dirt in a bag, a pen, anything that you can kind of fidget with, an ice or a heat pack to be able to put on your neck to kind of have like a different kind of body sensation to focus on, a playlist of music, a playlist of videos, of people to call, of places to go, having a card of with all of this information that's on this slide, as well as another really great thing to have for those moments of most intense crisis, so that you don't have to fumble around with trying to find someone's specific's phone number in your phone to call them, or if you don't have your phone for whatever reason, or if you have like a you only have a home phone, if folks still have home phones. I think some do. It also having like a safe place to go on there, a list of personal reasons for staying sober, examples of stress relief strategies, local support groups and the times of their meetings, hotline numbers. We provide them at the end here as well for the Colorado Crisis Service, so you can copy it down and put it on your card. And then locations of emergency services. If it's really coming down to it, it's absolutely okay to use those emergency services, go to the police, go to the hospital and ask them for support and being able to prevent yourself from relapsing if that is a resource that's available to you. Okay, so we can move next. There we go. So what does relapse really look like? Relapse doesn't really happen in one day or night. Relapse usually begins weeks or months before a person slips for the first time. A person goes through numerous motions before fully relapsing. So for example, an emotional relapse might be attending recovering meetings, but maybe not actively participating in them. Distancing yourself from supportive friends and family, hiding your emotions. A mental relapse might be during mental relapse, people can start to consider using alcohol or drugs or other drugs. They know they shouldn't, and they may try to practice coping behaviors. However, their negative mindset continues to negate other protective factors. People, places, and things associated with past drug or alcohol use can trigger cravings. People in mental relapse may romanticize past substance abuse or minimize the negative effects of drinking or using, and they may start to lie or look for opportunities to relapse. In some cases, they may even plan to relapse. And then physical relapse is more of what we typically think of when we think of relapse. So this is where someone might have their first slip. Someone might find replenished motivation for recovery after a physical relapse, or a support network might notice this and go through the motions of removing access to substances, asking about therapy. People who slip and don't seek help often experience a physical relapse. They begin using obsessively and compulsively, and they start to experience negative consequences from that use. So this can feel, there's definitely a lot of stages to it, and it can feel a little overwhelming to kind of understand the 3 different stages we talked about, but relapse doesn't happen in a day or a night. And so really trying to do everything that we can to prevent relapse as much as we possibly can, and supporting those our loved ones in that process as well. So here are some great discussion questions that we've come up with for y'all. You are welcome to kind of take these to anyone that you are you feel comfortable to talk about this kind of stuff with, and have these discussions with them. Really try and get into the nitty-gritty with them to determine if you believe relapse is part of a recovery. Does anyone have, or what your thoughts on different approaches to treatment are? How do you have conversations about boundaries, trust, and hard feelings? what has worked well for you, what has not. Having those conversations really relates back to that quote from when we started, of anything that we can talk about makes our feelings much less overwhelming, less upsetting, and less scary. Mr. Rogers really knew what he was talking about. And so with that, we can go to our next slide. And
I wanted to say something quickly, that there are no right or wrong answers to any of these questions, and they may rely heavily on like what your values are, and just recognizing that you and your loved ones might have different values around recovery, and just negotiating what that looks like for the one that is in recovery.
Absolutely. That's a great point, Louie.
So, would you like me to wrap up, Megan?
Yeah, that works.
Okay, I just started doing it, and then anyway.
That works.
Breaking the fourth wall here. So thank you so much for watching. So some of the resources we have available is Jefferson Center for Mental Health. That is our parent organization. Their phone number is 303-425-0300. That will shoot you to navigation, and they will support you with where you need to go. The physical location for crisis recovery is in Wheat Ridge. And then the Colorado Crisis Services line is 24/7. It is 1-844-493-8255. Thank you so much for listening, everybody.
Thanks so much, everyone.